This tape was recorded in 1977, and you'll note that in this lecture we do in fact downplay the use of hypnosis. In fact, the type of hypnosis we are talking about is hypnosis for symptom removal. Since 1977, the Institute has carried out far more research and found symptom removal to be a highly successful process. However, the other processes that we're talking about are the personality rehabilitation, which will be included in this course. In fact, this lecture was mainly aimed at people taking a course in personality rehabilitation. These processes are also very useful for the personality as a whole. But we can use hypnosis successfully for symptom removal, for changing behaviour, and we have many thousands of cases produced since 1977 which bear this out. Hence, when you have listened to this tape, remember that these were our views in 1977 and they're not our views in 1983. Symptom removal, as I said, is highly successful for behavioural changes, for phobias, for stress, and for many other conditions. In fact, symptom removal should be attempted first before searching for traumas or before going into other forms of complex processes. Thank you. This was edited and reconstructed in January 1983 by Dr. P.L. Goodwin. Recorded on the 17th of February 1983 at the Institute of Hypnosis and Parapsychology, Loxheath, England. The lecturer is Dr. P.L. Goodwin. All copyrights reserved 1983. Now, this tape is mainly about the fourth stage of hypnosis. Before we go into the depths or the interesting facts about the fourth stage of hypnosis, I think it's rather important that you differentiate in your minds between hypnosis and hypnotherapy. Now, hypnotherapy or therapeutic hypnosis is hypnosis used for the treatment of disease, injury, or illness. Therapeutic hypnosis, hypnotherapy, really only applies to cases which have been referred to you as patients by a physician. But the subject hypnosis covers a whole multitude of factors which you'll find listed in your notes, all the way from police work to the improvement of sportsmen, to the improvement of public speakers, and so on and so forth. Now, by no stretch of the imagination can someone who comes to you to become a better public speaker be conceived as ill, and they do not need treatment. They need a course of hypnosis to help them develop their particular aptitude. It's very important to use hypnosis and regard hypnosis as a course to help somebody improve an ability which they already have. So if you want to make somebody a fast reader, you are in fact improving on their ability to read. And these people are definitely not sick. On the other hand, if someone is referred to you by a physician, then they can consider to be having some kind of illness or disease or injury. Now, the important thing to remember about the fourth stage of trance is that rarely is it required for the type of work that you're engaged in. It's certainly required for spectacular stage hypnosis. It's certainly required if you have a physician who wishes to operate or perform a major operation on a subject instead of using a general anaesthetic. But by and large, it is not necessary to achieve the fourth stage or even the third stage in order to resolve a client's case using symptom removal hypnosis or running out traumas. It is necessary if you're trying to reproduce parapsychological phenomena such as past life recall, clairvoyancy, and similar acts of this nature. But it's not required in a day-by-day running of a practice. Now, if you read the old-style hypnosis books that were written somewhere around the 1930s or 1940s, hypnosis was used in a very limited way. It was used sometimes to bring about the birth of children for pregnant mothers. It was used to cure a skin disease which is known as crocodile skin, which is the appearance of a person having the skin of a crocodile that sometimes can be resolved by hypnosis. And it was also used for the running out of traumas known as hypnoanalysis after the war for people that had been very disturbed by being at the battlefront too long. And the old-style hypnotists tend to discard as many as 60% of their clients purely on the basis that they couldn't get them into the third stage of hypnosis. But things have evolved considerably since that day, and the Institute of Hypnosis and Parapsychology, as I said before, almost entirely uses the first and second stage of trance. Nevertheless, from time to time, you're going to be presented with a case which, even if you don't wish it, is going to descend at least into the third stage and sometimes into the fourth stage. So what is happening when somebody is in the fourth stage of hypnosis? Well, there has been a massive release into the brain of endorphins. These endorphins cause a state of general anesthesia throughout the client's body. Now, it's important to note that there's been no suggestion made for the anesthesia. It's just occurred. And in fact, the reason that it has occurred is purely because these endorphins have caused a similar reaction to if the person had been injected with opiate drugs like morphine. Now, in this state, with the person's consent, it would be perfectly possible for them to be burnt alive. If they decided they wanted to die in this gruesome fashion, then they could die without pain. They realised that their body was being consumed, but there would be no pain. To say it as if they'd been given a massive injection or several injections of an opiate drug. Now, with the fourth stage, the first thing that you'll probably notice, or the first thing that will occur to you when you're working with a client, is that the person will fail to wake up. Now, of course, we're not giving people tests for the fourth stage. We're not saying to them, okay, now I'm going to test to see whether you are in the fourth stage. If you did this and somebody was under light hypnosis, then they will feel that they have failed by not achieving the fourth stage, and your session would cease to work from that point on. So it's very important you don't perform these tests on people that you're trying to bring about a change in behaviour pattern, or to stop them smoking, or a weight loss, or to rid them of phobia. Because if the client feels that they're not succeeding, then the client won't succeed. So the only way that you're probably going to find out this fourth stage has been induced is when the client fails to wake up. Now, at this point, it's no good saying wake up, and losing your nerve or losing your confidence, because almost telepathically the client will pick up from you this loss of confidence, this anxiety, and it will make the client less likely to wake up rather than more likely to wake up. So the first thing you must do if your client doesn't awake, by simply counting to 10 or simply counting to 3 and snapping your fingers, is to use the wake up process. You'll probably notice that in this state, your client's head will roll from side to side. This is also an observation we make when we observe deep trance mediums in spiritualistic seances, or at least people who are members of the religion known as spiritualism. The head will roll from side to side. This is part of the symptom of lethargy. So how does this wake-up procedure work? Well, the wake-up procedure is purely designed to release into the brain of the subject antidotes to the endorphins which have caused the state of general anesthesia or have caused the lethargy in the first place. And what we do with the first process, we work on the right hand of the client. The reason is that the right hand of the client is connected to the left hand side of the brain. And when we are using the phenomena of hypnosis, it is through the right hand side of the brain that we have triggered the response. The left-hand side of the brain, you recall, is to do with the logical side of you, is to do with the rational side of you, and the right-hand side of the brain is to do with the subconscious mind. So we're going to work on the right hand of the client. The first thing we do is to give the client a command. Now, this command is addressed both to the left-hand side of the brain and the right-hand side of the brain, or it is addressed to the conscious self of the client and the subconscious self. But remember, we are working on the right-hand side of the body, the right hand, because it is the left-hand side of the brain that we're trying to bring back to the conscious state. And with good communication, we give to the command to the client, give me that hand. And at the same time we say, give me that hand, we treat the client like a child, we pick up the client's right hand and put the palm of their hand in the palm of our hand. And then we acknowledge that they have completed that cycle of action by using the acknowledgement, thank you. It's very important that when you speak to the client, you vary the tone of your voice, and you don't say thank you in a repetitive manner, rather like a metronome, i.e. it's no good saying thank you, thank you, thank you, give me that hand, thank you, give me that hand, thank you. Because you always sound like a Dalek, and that will only make the client more hypnotised, not less hypnotised. So I'll give you an example. Give me that hand. Thank you. 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 You'll note that I'm varying the tone of my voice. Remember, each time you pick up the client's hand, put their hand in the palm of your hand and grasp the hand forcefully, rather as if you're giving the client a handshake. Now you run this process until the client starts to revive. What would normally happen is that the client will revolve the head from side to side quicker and quicker. There will be a fluttering of the eyelids and there will be a tendency to breathe more deeply. Because in a deep trance, which has resulted, as this fourth stage has, from the release of endorphins, the client's breathing is likely to become quite shallow and their pulse rate is likely to have fallen quite low, as is their blood pressure. In other words, in a very deep state of relaxation. But remember that this state is not sleep. So you repeat this process on the right hand, if necessary, for anything up to half an hour. But normally about 5 minutes will suffice. Now when the client starts showing signs of waking up, and in fact has actually opened their eyes, then you can cease to run this process known as give me that hand. Remember, it's run on the right hand side of the body, and it's run with plenty of intention. You must will the client in your mind. You must wish that the client wakes up, because there's always a telepathic transfer from the hypnotist to the client. So if you will the client to achieve this objective, this will help the client wake up. Give me that hand. Thank you. Give me that hand. Thank you. Now what you will observe, as well as a fluttering of the client's eyelids and a tendency to roll their head from side to side, you'll also notice that the client is attempting to carry out the command. The client is receiving your word commands in the subconscious and the conscious at the same time. But as they become more conscious and their subconscious mind starts to close off, then they would start to cooperate by giving you their hand. And when they can give you their hand 3 or 4 times without you having to pick the hand up, then the time is coming to come off this process and go on to the next process. Now, the next process involves you actually raising the client to their feet. You might find at this stage that your client behaves as if they're drunk. Their arms will tend to stand or hang loosely at their side, their eyes and their head will tend to roll, and they'll have a tendency to fall forward. The reason is that you have not yet got out of their bodies the original drug, the endorphins that were released, which caused this state of lethargy, and of course general anaesthesia. So you are still trying to get the chemicals, the antidotes, released from the brain of the person. So this is why they're not fully awake. But if you persevere, these symptoms or these signs of the fourth stage of trance will very rapidly wear off. Now for the next process, you require 2 walls of a room. Stand the client facing the other side of a wall, ideally about 12 or 15 feet away from the wall. And you say to the client, you look at that wall. Now often the client's head will not be raised. So very gently, keeping the client on their feet, keeping close hold of them, you gently raise their head by putting your hand under their chin and point their head towards the wall. So the command is, you look at that wall. The next command is, you walk over to that wall. And very slowly, you take the client over to the wall. When the client has when the client has reached the wall, you then say to them, thank you. A definite acknowledgement, a definite communication with plenty of intention in your voice. Then say to the client, turn around. And when the client has turned around, again you say, thank you. Now these acknowledgements are very, very important because you're trying to communicate with the consciousness of the client. You're trying to increase the amount of consciousness. You're trying to bring the client back into the physical world. You're trying to bring the client back into a reality containing space and time. Hence the reason for 2 walls, so that the client realizes there is a space between the 2 walls and there is a time interval needed to walk between the 2 walls. Now, the next command you give the client is to point him looking at the opposite wall, or point him in the opposite direction. You say to him, you look at that wall. Again, lift his head by pressing under the chin. If his eyes are closed, very carefully, using one hand to hold him up under his chin, very carefully, grab hold of his eyelid and raise it. Very carefully, open his eyelid and point him towards the wall. Now the thing is, he will begin to see things in more of a solid fashion. He'll be coming out of this misty state caused by the release of endorphins, which have been triggered off by your hypnotic triggers, and he will begin to realise that he's standing in a room with two walls. Now, of course, this is a bit exaggerated because normally by the time the client has come to his feet, he might already be awake. But if he's not awake, then you must run this process. Next command, you walk over to that wall. Again, very carefully, you move the client over to the wall until he has reached the wall. You then give him the command, you touch that wall. If he can't touch the wall, you pick his hand up and very carefully, with his palm outstretched, you get him to feel the solidity of the wall. You get him to feel that there's a solid wall there. Again, the command, thank you. Once more, turn him round and ask him to look at the other wall. But you've got to give him a command. You look at that wall. If he needs any help, raise his chin and open his eyelid. And then acknowledge that he's done it. Thank you. You see, it's a variation of give me that hand. What you're doing is encouraging the client to carry out your commands with their conscious mind rather than robotize through their subconscious. Because if you've got somebody who's in the third stage and you give them a command, if you tell them that their hand is absolutely rigid or their arm is absolutely rigid, they won't be able to move their arm. In other words, their subconscious has registered the implant. They're not acting on their own determinism, they're acting on your determinism because they're still hypnotized. So the trick is to get the person up to the third stage and then get up to the second stage or the first stage where they will carry out your commands with their conscious self rather than their subconscious self. So it's very important not to ramble or set up any vibrant hum or any Dalek-like repetitiveness with your commands. Once more, you ask the client to walk over to that wall. When they've walked over to that wall, you say, thank you. Now, touch that wall. Once again, if necessary, lift their arm up and put the palm of their hand against the wall. Thank you. Turn them round with your own body close to theirs. You look at that wall. Thank you. You walk over to that wall. Thank you. Again, when your client is showing more signs of revival, then it's time to go on to the third process. Now, the third process, whether you're dealing with a male or female, involves two chairs facing one another, with the client sitting on the chair and you facing the client on the other chair. You want to take your legs and get the client's legs in between yours, so the client's legs are pressed together and your legs are lightly resting against the outside of their legs. Hence, you are in a close position of proximity to the client. And then you ask the client to raise their hands in front of them with the palms outstretched, rather like a Buddha-type figure about to say his prayers. And you raise your hands likewise, and you press the palms of your hand against the outstretched palms of the client. Just a little pressure, don't push the client backwards, because remember that very often they could still be in a groggy state. Now, whilst you're pressing your hands against the client's hands, you give the command, which is as follows. I'm now going to make a movement with both hands. When I make this movement, I want you to duplicate the movement and follow my hands exactly. In other words, it's rather like an O'Grady says situation, except that the client has physically got to move their hands as you move your hands. Now, when you start this process, don't make it too difficult for the client. Try and give them some successes, try and give them some wins. And just make a very slow movement with the left hand, move the hand up very slowly and move it back to its original position. And then move the right hand up very slowly, back to the original position. Each time you give them the command, I'm now going to move my hand, I want you to duplicate the motion, I want you to follow exactly what I do. Then perhaps you could move both hands up about 12 inches and down back to the original position, 12 inches down. Do this very slowly, very deliberately, no jerks, no forms of trying to trick the clients at all, just try and give them confidence. Assume, if you like, they've got some kind of mental handicap and you're teaching them to use their limbs in the proper fashion. Next movement perhaps can be a circle with one hand. I'm going to move my hand I want you to duplicate the motion, and then you make a movement with the hand. Now, each time you have finished each action, each movement, acknowledge that the client has done it by saying good, okay, fine, etc., etc. So you must acknowledge that the client has completed the action. Once again, say move both hands, one hand out to the left and one hand out to the right, very slowly and very deliberately, and ask the client to follow your motion. When the client has done this, once more you acknowledge the client, because remember, you are addressing their conscious self, you're addressing their conscious mind, and you want to let them know that they have completed your instructions satisfactorily. Okay, now I'll do a few more commands. I'm going to move my hands. I want you to duplicate the motion. Move your hands, acknowledge the client's movements. Are they good, fine, okay, or thank you? And keep doing this for a few more movements. Now, after the client has carried this out satisfactorily, you introduce a variance into the movement by asking the client, to hold their hands in front of you, at this time about a ½ inch apart. So there's a space of a half inch between the two palms of the client's hand and your hands. Remember, they've got two hands up in front of them, and you've got two hands up in front of you. Now this time, move very, very slowly. You'll see that the client will quiver. Sometimes their hand will go too fast, or their hand will go too slow, and they will get ahead of you, or they will get behind you. Use it by doing one hand at a time. Move the hand very slowly up, and then very slowly down, acknowledging with a fine, good, okay, the client has carried out the movement. And then with the other hand, or their hand will go too slow, and they will get ahead of you, or they will get behind you. Use it by doing one hand at a time. Move the hand very slowly up, and then very slowly down, acknowledging with a fine, good, okay, the client has carried out the movement. And then with the other hand, or the hand will go too slow, and they will get ahead of you, or they will get behind you. Use it by doing one hand at a time. Move the hand very slowly up, and then very slowly down, acknowledging with a fine, good, okay, the client has carried out the movement. And then with the other hand, raise the hand very slowly, with the client's hand a ½ inch apart from yours, and then move the hand back down. Again, thank you, good. I'm going to make a movement with my hand. I want you to hold your hand ½ inch from mine and duplicate the motion. This time perhaps you could move both hands up and both hands down. Don't try and trick the client up. Now, after a few movements, you can tell the client you now want them to put their hands 2 inches apart, 2 inches between your hand and the client's hand. This, of course, makes it more difficult. It's not so easy for the client to do. Again, tell the client you're going to move your hands and you want the client to follow your movements exactly. And once again, holding your hand, move the hand up, move the hand down. Make a circular motion. You can vary the motions to make it gradiently more difficult for the client. Hopefully by now the client is carrying out these commands quite nicely. Again, you could have to run this process for anything up to half an hour. Unusual. Normally it will require 5 to 10 minutes. Important because you are checking the dexterity of the client, because they may be leaving your consulting room and driving home in an automobile. You don't want them falling back into the trance in the automobile, resulting in some kind of claim against you by the client. Although we do have insurance for this, we don't want claims. So if your client is satisfactorily carrying out these motions, you can then go on to the fourth process. Now for this process, you sit in front of the client, you have the client's legs, whether it's a male or female, gently, the legs closed together with your legs on the outside. So you're sitting very close to the client. You give the client a book and you hold a book. And this time you explain to the client that you're going to make a movement with your book. And when you have finished the movement with your book, then you want the client to make a similar motion, proving that the client's memory is functioning, their rational memory, that they can observe what you're doing, they can remember it and carry it out. If they can do this process correctly, then you know that they are fully conscious. So the command you give here is, I'm going to make a movement with this book. I want you to produce an exact copy of the movement I make. You then make your movement with the book. The first movement you make may be a straightforward raising of the book, 3 or 4 feet, and lowering of the book. You then ask the client to duplicate the motion of the book. Hopefully the client will also raise and lower the book. It's important and essential to check they do it at the same speed, that they're not slower and they're not faster. Remember also to acknowledge the client using the acknowledgement good, fine, okay, or thank you. You might even give the client some encouragement by saying, "That was very good. I can see that you're very much awake now." You make another movement with the book, again asking the client to copy you and duplicate the motion. You say, "I'm now going to move the book, and I want you to copy this motion." This time you could make a circular movement with the book. Cease the movement, make these movements very definite and very clear and very slow. And then ask the client, "Please duplicate the motion of that book." Hopefully the client will make a circle. Very important to make sure that the client moves the book the same way that you did. Exactly. So that they trace out the same path and they don't give you some kind of opposite reaction, like a mirror reaction. Make sure the book moves exactly the same path as you moved it. Once again, you acknowledge the client and say thank you. You might make a more complicated movement with the book. You might make a T-shape. Again, ask the client to duplicate the motion, and hopefully the client would do that. Again, you could run this process for up to half an hour in extreme cases. In fact, I have on the video course, which is an extension of this course, it's an additional course where I have these phenomena videoed. You in fact will see a client being brought out of the fourth stage of trance. In fact, when I filmed this particular film, it took so long that I had time to go outside the consulting room where my associate was running the wake-up procedure, have my tea, come back and continue filming. Obviously, you wouldn't want to watch a 2-hour video film of someone doing exactly the same thing. But this client, who was a doctor's receptionist, in fact, took something like an hour to bring her out of the fourth stage of trance. Now, when you start work as a hypnotist, you're always and every time going to be intrigued when you get somebody in the fourth stage of trance. You're going to think, what a great hypnotist you are, how clever you are, how fantastic this is. It is a fantastic thing. The fourth stage of trance is almost a paranormal phenomenon. It's a very exceptional thing to see. However, if you're running a busy practice, as I hope you will be doing, then it becomes a great nuisance, because to have people waiting outside to see you when you've got to spend an hour waking up a deep trance subject can be, to say the least, very inconvenient. So the fourth stage is a fascinating stage, but it has very little adaptability to the normal practice. Although, as I say, it could be used to replace a general anaesthetic. It could be used for somebody who wanted to have a painless childbirth, who would normally have a difficult childbirth or would need some kind of minor surgery. It has no direct application. And the fact you get somebody into the fourth stage of trance doesn't mean that the results from the course, although they are going to be very spectacular in the sense that somebody who's a fourth stage subject may need only 2 sessions of hypnosis, while somebody who you can only get into the first or second stage, not that you need to go any further, may take 4 or 5 weeks to achieve the same objective. The actual duration and the stability of the client is not affected whether they are deep trance or not. To assume that if a client is deep trance, they're going to remain in a stable state is just not true. It will merely mean that you'll be able to achieve the same result quicker, but the client won't necessarily stay with that result any longer than somebody who's only a first or second stage subject. The first or second stage subject will need to go home, they need to work 7 days a week with their cassette recorder, but they can still achieve the same implant in their subconscious mind as the fourth stage subject, with the exception of extreme pain control. Even in the first, second and third stage of hypnosis, you can reduce the feeling to pain, you can reduce the effect of pain, but not so dramatic as with the fourth stage. If you're going to operate on somebody to replace a general anaesthetic, then you'll need them in the fourth stage. But for practically anything else, for getting rid of phobias, for getting rid of feelings of lacking in confidence, for getting rid of stress or anxiety, then it's only necessary to get somebody in the first or second stage of trance. That's something I always do with my clients, so I've done over the last 20 or so years since I've been in practice, is always announce to my client at the start of the initial consultation that all I'm going to give him is light hypnosis. Therefore, the client will feel reassured from 2 points of view. One, he will lose the fear that he's going to go into a deep trance and perhaps do something against his moral code. He's also going to realise that if he doesn't go into a deep trance, then he's not in fact fouled and the session has worked for him. If he believes he's got to go into a deep trance, then he will feel fouled if he cannot reach it. If he, on the other hand, as most people, are frightened of going into a deep trance, then if he thinks he has to go into a deep trance, or he will go into a deep trance, then he's going to feel a sense of fear, which is going to prevent you achieving the results that you want to. Now, I think I mentioned something here about morality and codes of ethics. It's often said on radio and television when a hypnotist is interviewed that people can't be made to do things that they don't want to do, which are against their moral code in the state of hypnosis. Well, I think these people, when they are giving these announcements to the press or to the radio or television, are trying to reassure their clientele that there is no fear or they need no anxiety of going into the hypnotic state. Basically, what they say is true. However, you must remember that most of our religions teach us that we shall not kill. Yet the way our governments hypnotise us into forgetting these moral codes is to tell you that we're now going to go to war and we're going to destroy the enemy. Now, if you make people a national enemy, then basically you're telling people it's all right to behave in a moral way towards the enemy. It's all right to trick the enemy. It's all right to lie to the enemy. It's all right to destroy the enemy, although you would never, in fact, think of doing this to your neighbour. At least we hope not. Unless, of course, the neighbour has been declared an enemy by your family, and then the thing becomes somewhat confused. So what I'm saying is that people can be made to do things in trance, or after they come out of trance, by the use of a post-hypnotic, even if it was something which they wouldn't normally do. If you tell them that they are going to carry something out for some social purpose, or some purpose on the 4th, the 5th, the 6th, or even the 7th horizon. In fact, you've got histories of the churches who went out and destroyed people who opposed them quite happily because they declared them the enemy of their church. So be very careful when somebody's under trance not to persuade them to do something which you really know that they wouldn't normally do by giving them some social implant, like telling them that when they wake up, the next person that walked into the room is an enemy of mankind. It is a person who has to be destroyed for the social benefit, for the social good, because under those circumstances, you could persuade a person coming out of trance to... Because under those circumstances, you could persuade a person under hypnosis to do something that would be in conflict with their personal moral code, but it would have to be something that was in agreement with the social code or the legal code. Now, the reason I tell you this is because I want you to know the truth about the situation, but this is something I don't suggest you try to explain on radio or television, because it could well put people off hypnosis, give them some kind of fear, and make them think in some way you're trying to manipulate their minds. And this, of course, is something you must never do. Now, I think I should further explain the difference between a technique for hypnotising somebody and a process. Now, the technique is how you hypnotise a person. The process is how you're going to use that state of hypnosis in order to get the client to achieve their aims, their desires, and their goals. And we have a series of processes and we have a series of techniques for hypnosis. So you hypnotise the client with the technique, normally only into the first or second stage. It doesn't matter, in fact, if they go into the third stage, but you're not primarily trying to aim for that. And then you apply the right process. If it's a smoking process, well, then it's a process to stop them smoking. If it's an anxiety process, then it's an anxiety process which is going to stop them being anxious. The important thing is, having recorded the session, then the client will take their tape away from the session and play the tape at home for once or twice a day until the next appointment. And the appointments are normally a week apart. So the client has been able to give themselves perhaps 6 or 7 sessions since your last meeting. And this repetitive technique is so much more effective than giving the client just 1 session a week. Because although the tape recorder is not such a powerful influence as yourself, it is an extremely strong influence and does help you achieve the aims and goals for which you are hypnotising the client. Probably the problem with the earlier hypnotists was that they didn't make use of the tape recorder, or the tape recorder hadn't been invented to a level where it was cost effective for the client to buy one and use one at home. And this is why a lot of the clients were discarded, merely because they couldn't go into the 3rd or 4th stage of trance. So remember, it's a number of sessions you give and not the depth of the hypnosis, leaving out the exceptions of operations and other unusual uses for hypnosis. Hypnosis is never going to replace a general anaesthetic for an operation, because everyone cannot achieve the 4th stage. However, as far as medicine is concerned, hypnosis could greatly reduce the amount of local anaesthetic needed to be given for something such as a tooth extraction or for a cataract operation on the eyes, because the reduction to pain or the increase in resistance to pain is considerably reduced in the third stage. And many people can achieve a deep second stage or a third stage, which is sufficient for normal pain reduction. The important thing to remember with this Institute of Hypnosis and Parapsychology is that it's been around, or I've been around, for some 20 years practicing as a hypnotist. I've practiced both in the United States and also in the United Kingdom. I've also trained hundreds of hypnotists to go out and practice, mainly in the UK and more recently in the USA. And we do know that the processes that we use in this institute do actually work. We do not use a process or put the process out or use it on the public until we have tried many cases. We give these processes out to various practitioners who try these processes, and then we give them out to all the practitioners, so we do know that these processes work on a statistical basis. In fact, you will find the processes of this institute will work in 80% of cases. If it's going to be less than 80%, then we will mark the expected result as a percentage on the process we give you. So if you take the smoking process, then you can reckon that 80% of the clients that start your smoking course will actually stop smoking. Now, some of these might well start smoking again and they need to come back for one single session, but 80% of them are initially going to stop smoking. Quite a few will start again later in the year, but if they come back for a further maintenance session, then they're unlikely to go on smoking. Of course, some of them will. So the smoking process has an 80% success rate. Similar with the weight course. The weight course has an 80% success rate, and so on and so forth. Now remember, we're talking about percentage of clients who actually start the course. So if anything, at the initial interview, we tend to put clients off, so that we only have the clients starting who are keen, determined, and who have the motivation. Because remember, not only is the skill of the hypnotist important, and not only is the receptivity of the subject, then there must be motivation on behalf of the client. If there's no motivation on behalf of the client, then the client will not be successful. Another factor is, of course, using the correct techniques and processes. But you've already got the correct techniques and processes in this institute, so you don't have to worry about that. You can very quickly acquire the necessary skills, which are quite safe, without danger. So really, in the last analysis, the most important thing is the motivation of the client. Do not accept clients that have no motivation. If you accept clients that have no motivation, then you will tend to get poorer case results, rather than if you use the standard procedure, which is to separate out the motivated clients and just go for your motivated clients. Now, this waking a client up out of the fourth stage is very important, because had you attempted to hypnotize somebody earlier on in this course, before you got to this part of the course, then you could have been purely statistically unlucky and picked somebody who went straight into the fourth stage. You might not be able to have woken them up. You might have thought that they were suffering from some kind of disease that had gone into a coma, or they were very ill. You might have called a physician who knew nothing about hypnosis, and before you know where you are, you've got a person having some kind of psychiatric treatment, which is totally unnecessary had you realised the only problem was that they'd gone into the fourth stage of trance and you hadn't woken them up. And this really is the only risk with the hypnotic procedures, if you get somebody into the fourth stage of hypnosis and you don't know how to wake them up. So I hope this lecture has helped you to discover and understand how to bring a client out of the fourth stage. You won't have too many clients in the fourth stage, and remember always to emphasize light hypnosis. I'll give you an example how I present this to my client. After I've done initial consultation, I say to the client, "Okay, Mrs. Jones, now all that's required to achieve this result is light hypnosis. In a moment, if you decide to take this course, I'm going to teach you how to put yourself into a light trance. You'll be fully aware of everything that's going on. Any time, if you wanted to, you could get up and walk out of this room. Of course, you won't do this because you've come here and paid a fee to achieve the result. But I want you to know that you'll be in full control all the time. I require your cooperation, but at any time, you could end this session of your own free will." Now, it's just possible with a small number of clients, probably about 1 in 40, that they can enter into a very deep state of hypnosis. If you are one of these, then in fact what I will do, rest assured, is to bring you out of this trance. I have another process, and just as I can use a process to put you into a deep trance, I have a process to bring you safely out of a deep trance. So you may have no worries, Mrs. Jones, that you might enter a deep trance, because if you do, rest assured, I will bring you out of it. And also remember, it's not necessary for you to achieve this deep state of trance. And for your first session, I'm going to give you some simple relaxation exercises. I'm going to put some earphones on your head, and I'm going to talk to you through these earphones and introduce a state of light hypnosis. The depth of hypnosis will increase with each session. When you play this tape at home, you will be conditioning yourself in time for the next session. Okay, Mrs. Jones, shall we start now? Or would you prefer me to book you an appointment next week? Now, that's part of the technique of how to get the client started as well. It's very important you give them this little pep talk at the start, right at the start, to reassure them that they only need to achieve a light state of hypnosis and that you can handle the situation should they go into a deep state of hypnosis. I hope you've enjoyed this lecture and learned something from it about the full stage of trance. Thank you.